Well, the Treatment Action Campaign is calling on government to give TB the same attention as COVID-19. The organization wants TB declared a public health emergency. During the lockdown, many TB sufferers either did not do follow-ups or defaulted on treatment. The TAC wants government to conduct contact tracing, much like it has with COVID-19 patients, and get these missing patients back on a treatment plan. Joining me now via Zoom is Anele Yawa, General Secretary of the TAC. Thanks for your time. We appreciate it. So you want government to declare TB a national health emergency. Do you reckon that'll be done, though?
Thanks for having us, and greetings to you and the viewers at home. As TAC, we have taken a conscious decision to say, let's embark on a campaign where we advocate for our government to declare TB a national health emergency. Reason being that is based on the fact that we've got high number of TB new infections. We've got high number of TB deaths. As you have given the background that we've got, according to the World Health Organization report released 2019, it shows that about 58,000 people died of tuberculosis, and within that 35,000, we've got 36,000 of people who died of TB, and those people are people living with HIV. We can see on the ground what is happening. What is happening on the ground? As TAC, we are demanding that as the country, we need to do to TB what we did to COVID-19. That is one of our call. Why are we saying this? It is our wish as TAC to send, and as well as many public healthcare users and citizens of the country, to see that TB is taken serious. There is political commitment, there is a political will, the same way it happened to COVID-19. What we mean by this? We mean by saying that we would like to see the Minister of Health to give the country on daily basis statistics of people who are contracting TB, people who are dying of TB, and people who are recovering from TB. But also we would like to see our government injecting more resources on TB response the way we did to responding to COVID-19. We would love to see our government establishing a national TB task team in Parliament that will take critical decisions and pay more attention on issues of TB. The reason we want government to put more resources on TB, we've got healthcare workers and community care workers who are on the front line of TB response. And at the present moment, in our country, we've got a huge shortage of human resource. We're still having challenges with the state of our clinics. We're still having a challenge with the shortage of medicines that we still experience in our facilities. But also we're still experiencing a challenge of high expensive TB medicines that are effective, which are inaccessible to poor people on the ground. Yeah. But we will be glad if also we can screen people for TB when they go to our clinics the same way we do for COVID-19. Because if we don't do that, one person who contracts tuberculosis and that person not being attended, chances of that person infecting many people are very high. So to stop TB, we need to take some drastic measures. But on top of that, our response to tuberculosis must not be on boardrooms. It must be at community level and at facility level. We have seen during the hard lockdown between April and July this year, many gates of many clinics were locked. HIV and TB services were not provided to the people. The only priority was COVID-19. And as the result of that, many people decided not to go to clinics because some of them, they experience these injustices in our facilities. And then many people are lost on follow-ups. Many people have defaulted on TB treatment. It is against that reason we are saying to our government, civil society, funders, and all of us, let's go to our communities. Let's go and trace people who are living with TB. After tracing them, let's link them back to care. But also, it is not going to help to link these people back to care if the problems that they experience in clinics are not resolved. What are these problems? Some of these problems are related to staff attitudes, where at times they will shout at people who missed their appointments, where at times they will disclose the status of people, where in many a times people are forced to wake up as early as 5 a.m. to go and collect their medicines, and they will only be attended at 2 o'clock. So these are the barriers that makes our healthcare system to be broken.
Yeah. All right. I just need to know how realistic you think that is for government to implement, given that we're already dealing with COVID-19 as a pandemic as well. Will you wait a while before you reckon it should be treated the same way, or do you want it to be done simultaneously?
We want it to be done now. Being realistic. So, as much as I'm not a fortune teller, it is the will of the people that will make it being realistic. If we as the people, as the public healthcare users, as civil society and government, we don't stand up and speak with one voice as to say this must come to an end, then it means it will become realistic. All what is needed now is political commitment and a political will. Political commitment and political will is what is going to make it being realistic.
Yeah. All right. Thank you so much for your time and your insight. Appreciate it. Anele Yawa, the TAC's General Secretary. Still to